Hey folks, Dr. Tassone here again, just coming back to do another Facebook Live and maybe talk about estrogen this time around. We talked about hormones last time, and I had a really good response to that. I think we answered a lot of questions. I'm using a little sticky thing on the wall here, so hopefully it won't fall off in the middle of my talk. I may keep reaching up to make sure it's sticking because in my test run it fell off on me. So let's talk about estrogen dominance. I mean, what is it? Is it too much estrogen? Is it not enough progesterone? I think ideally what we're looking at with estrogen dominance is too much estrogen. And that can be in a couple of ways. One could be you simply just have too much of the hormone estrogen. Let's talk about estrogen real quick. What does it do? What is it? Where does it come from? Well, there's multiple places that estrogen comes from. The two main ones, though, are going to be your ovaries and an aromatization of testosterone in your fat cells externally. So, i.e. the more fat cells you have on your body, the more estrogen you might have circulating. Another form of estrogen that we are getting nowadays is going to be in the meats we eat, in the external plastics that we consume, some inserts that are in the bodies that use chemicals like polyethyl terephthalate, or we have bisphosphonates and things like that in the society. There's the controversial aspect that maybe some of the birth control pills that women take, we're excreting that estrogen into the water system. That's controversial, but that's a possible way we can be getting too much estrogen. So what do we do with all this estrogen? Well, for women, when you have too much estrogen, you can have things like breast tenderness, irregular bleeding, increase in uterine cancers, headaches, mood swings, just kind of a generalized feeling of you want to choke someone out, a lot of bad things, water retention, not sleeping well. And estrogen dominance is probably one of the most common hormonal disorders or hormonal imbalances that I see in my practice. Estrogen dominance, I would say 80 to 90% of women that come in complaining of issues probably have estrogen dominance. And it's sad to say, but that's the truth. And the thing is that without estrogen in your body, you wouldn't function very well. That's menopause. So you need estrogen. It's just how much estrogen do you need in relation to progesterone, in relation to your other hormones. So let's talk about balance. Let's talk about estrogen dominance. So with estrogen dominance, you're going to have a situation where you have too much estrogen. It could be that your progesterone's normal, but you have too much estrogen in relationship to your progesterone. And a double whammy would be if you had way too much estrogen and you also had a progesterone deficiency. And let's call those women mothers. I mean, boy, you're just running yourself ragged and you're working on basically nothing. You're burning the candle, but you're burning it with a blowtorch, as it were. The women that have just straight estrogen dominance, this is something that we can try to clean up in multiple ways. So one would be to look at supplementation. And one of the biggest supplements that we can use to decrease estrogen levels is called DIM. And DIM is the active part, or a very nice part of what we call cruciferous vegetables. We can do, I know, Cynthia, I saw it. It was great. You did awesome. Yeah. We need to do something together. So estrogen dominance, DIM, broccoli, Brussels sprouts, that category of cruciferous vegetables. The problem is it's sometimes hard to eat a lot of broccoli, a lot of Brussels sprouts, makes you gassy. Some people don't like it and they got to put all kinds of stuff on it, like Velveeta, which is awful, by the way. So what do we do? Well, you can buy DIM. One of my favorite products is DimEvail, which is DIM-EVAIL by a company called Designs for Health. I don't have any stock in the company or anything. It's a 200 milligram dose. And if we can block the estrogen, or at least reduce the amount of estrogen that you're making, then we can decrease some of those symptoms. And I've had some women that have lost 6 pounds in 2 weeks from just being on DIM alone, because they're bringing those estrogen levels down, they're diuresing a lot of their extra fluids, and they're feeling better, which is kind of what we're looking for. Another thing would be to look at possibly using progesterone. If we can increase your progesterone levels, we can offset some of the estrogen effects. Progesterone is a good diuretic. It blocks estrogen receptors in the body. And there's just an overall attempt to balance. The problem is I like to see the estrogen to progesterone ratio at about 10 to 1. And most of y'all that are in estrogen dominance, we're talking 100, 1,000 to 1. So even adding a little bit of progesterone may not get you where you need to go. So let's look at some other things. Exercise. The more you exercise, the more you're going to burn your fat. You're going to decrease that external aromatization of your testosterones into fat. You're going to feel better, and you're also going to use the estrogens that are in your body more. So the more that you exercise and do, good old-fashioned, much as it sucks, diet and exercise, as much as you can increase fiber, because fiber is going to absorb extra estrogen in your gut. It's going to help balance the bacteria in your gut. And you'll obviously feel better, look better, and do better with a little bit of exercise and some dietary shifting. And I would also probably add throwing out any processed carbs. My doctor just challenged me to eat less than 20 grams of carbs a day. I've been, and I only say that because it's like hard for me because I'm Italian and I love pasta and I love bread and but I've been doing it for almost 3 weeks and I'm down about 10 pounds. So it works. I know there's the movie out, What the Health. I don't necessarily agree with everything that's in it. I think eating a lot of vegetables is a good thing, as long as we don't gravitate towards the starchy vegetables, your beets, your carrots, and peas and corn, and try to eat more cruciferous vegetables, which would obviously help with estrogen dominance. So that's nutrition, exercise, supplementation. To get a little out there, there's also the energetic aspect of estrogen, and a lot of people don't talk about that, but it could be, if you look at Western or Eastern medicine, you look at Ayurveda, you look at acupuncture, there is an energetic aspect to the body that if the energy that's blocking the ovarian, hypothalamic ovarian axis isn't working properly, and I'm not saying you have to believe this, but this is something that is believed in certain cultures, that you may want to look into maybe getting acupuncture, maybe using some infoceuticals, which is energetic driven water made by a company called NES. Again, I have no monetary gain here. I'm just bringing out different options. Hormonal modulation is something like adding progesterone, because progesterone is a natural estrogen receptor blocker, and you might offset some of your symptoms that way. And then finally, I kind of, I don't know what people, do in their lives, and I'm not pretending to be the most spiritual human being. I try, but sometimes a spiritual practice can help, in my opinion, lower estrogen. And I think that means lowering your stress, helping with your fat burning abilities by doing stuff just simply like yoga. Yoga not only is a great form of exercise, but it's a great spiritual practice. You're bringing your mind and your body back together for a change. And, in this society, we don't do well. And actually, the PCOS diva, who's here on Facebook, actually just sent me a note, which is interesting because PCOS, or polycystic ovarian syndrome, is a huge cause of estrogen dominance. And in that syndrome, you have a woman that makes a bunch of little cysts on her ovaries, and all those cysts are making tons and tons of estrogen. With that happening, you don't get the ovulation, so you don't have a period every month, and because you don't have the ovulation, you're not having your progesterone production. So not only are we estrogen dominant in that state, but we're also progesterone deficient. So something to think about, something to look at. Estrogen dominance is very common and also very troublesome for a lot of women. And I would want you to ask questions if you want. I'll be more than happy to answer them. As Cynthia Thurlow just said, she just did a TV show on it. It's a very common disorder. It's something that we see whether or not you are overweight. Some women, it could be in the foods that you're consuming. It could be in the meats that you're eating. Could be in some of the medications, especially birth control pills. Hello. Birth control pills are a hugely estrogen dominant state. And not only is it estrogen, but it's a synthetic estrogen, and controversial topic, obviously. My friend Jolene Brighton talks about post-contraceptive syndrome, which she believes, and I will definitely listen to her. She's an expert on the topic, that sometimes you can have issues with that extra estrogen dominance. I prefer bioidentical hormones. Lynn just joined in. Lynn's a compounding pharmacist. I think she would agree that bioidentical hormones you know, you can't really say better, worse. You know, I'm not going to make any claims that are going to get me in trouble, but I have been using them for 10 to 15 years. Your body recognizes those hormones better. They fit that kind of lock and key. The hormone fits right into your natural receptors. And so it's easier on your body. You don't have to convert it. It's not made from something like horse urine. The other issues are, like Rita talked about. I did a surgery on Rita to remove her Esher, and she's got no energy. It could be estrogen dominance, Rita. It could be estrogen deficiency, testosterone deficiency. You know, you can call the office tomorrow, 512-956-0296, and we can definitely get you tested. My phone is falling like I thought it would. So we can definitely get your hormones checked and find out what's going on with you. So let's answer some questions. There's 12 of you live, 13 live right now. If anybody has any questions about their hormones, about what certain hormones do, doesn't have to be just related to estrogen itself. It could be progesterone, testosterone, cortisol, thyroid, any of those things. Which again, Rita, thyroid could definitely be something that we need to look at in you. It's something that obviously runs your metabolic rate. So if you're constantly tired, it could also be progesterone deficiency. Maybe you're not sleeping very well, and progesterone is very good for sleep. So it's one of those things that we have to just get your levels and find out what's going on. Jenny just posted the phone number to the office. Any of you that are already patients that want to have your hormones checked, we can actually send the request to a lab where you live, and we can get those going for you. What are ways to lower testosterone in a PCOS patient? So that's a good point, Lori. PCOS patients also can have high testosterone levels because the ovaries make about 50% of the body's testosterone in a woman. And what happens is, as those ovaries are churning and being stimulated by a hormone called LH, or luteinizing hormone, in the pituitary gland, it causes the theca cells lining these ovarian cysts to make extra testosterone. And when you're making extra testosterone, you're going to have the side effects of extra testosterone: hair growth, you know, stomach, face, things like that, acne. Lowering your testosterone is difficult, especially if it's PCOS related. I would say the best way to try and lose or lower your testosterone is to try and get rid of the PCOS. And that's the hard part. And I would encourage you to really look at lowering your carbs to less than 20 grams a day to burn off that fat. Most women have this point in their body, and I can't tell you where it is because everybody's different, but where if you lose like 10 or 20 pounds, those ovaries will just kick back in again and the PCOS will go away. Most women that have PCOS can remember a time when they were like 20, 30 pounds lighter and they had normal periods, and then all of a sudden things kicked in and got kind of crazy. So I would definitely focus on diet and exercise for those. Vival.dot is a bioidentical hormone, Sheila. It's a good hormone if it works for you. It can, at higher doses, put you into estrogen dominance, so it might be beneficial once or twice a year to just get your estrogen level checked while you're on it to see how you're feeling. Linda Marie, using Depo estradiol and Depo testosterone cypionate as a HRT, good or bad? If you're a man, testosterone cypionate is great. If you're a woman, I wouldn't use it at all. I think that Depo testosterone for women is dangerous. This is my opinion. I think it's because there's no standard dose for women. And men take about 100 milligrams a week, 200 milligrams every 2 weeks. The problem with Depo testosterone in a woman and men is that you're going to get a spike in your testosterone levels for a few days, maybe a week, and then it slowly peters out. I don't think it gives you necessarily an even level. And then you can't give women a low enough dose of testosterone cypionate. And obviously that's my opinion, but I don't see the point in injecting testosterone into a muscle with the risks of infection, hematoma, nerve damage, things like that potentially, that would ever give you cause for an IM injection of testosterone in a woman. If you want to have the lab sent to me, Lois, you certainly can. Cynthia, what are your thoughts on thin females with low PCOS or with PCOS? Because we know that 25% of the women with PCOS are thin. Those women might come in with a issue where they're not having their periods every month, maybe every 3 to 4 months. They might have issues with infertility because they're not ovulating every month. They can have some of the similar symptoms because they're going to have increased testosterone levels as well, where they'll have hair growth, acne. Some of these girls might also be endurance athletes. Endurance athletes, not as much, but sometimes just athletes in general, they have a higher demand, and their hypothalamic to pituitary to ovarian axis might be a little messed up because they don't have the same amount of fat to buffer things. Their body has to use hormones a little bit differently because they probably have more of a demand, and it's just more difficult. But yeah, we know that 25% or so of women that have PCOS are thin and appear to be even ideal body weight. She'd probably kill me for saying this, but my wife might actually have had some of that when we were trying to get pregnant years ago because she wasn't having periods routinely. And I think some of that was stress related. She has a great diet and exercise plan, so I doubt that was it. But we don't know. It could be a little bit of a genetic component to that. And it's something that I think we need to consider. Just because somebody is thin doesn't mean that they don't have polycystic ovarian syndrome. So my son is texting me. When I have 15-year-olds, they text you whenever they want. So what other questions do we have out there? Cynthia, I really appreciate your questions. They're great. Cynthia, if you have a page, if you have a Facebook page and you want to post it here, feel free. I have no problem with that. The more information, the better for the women here. So estrogen dominance. Too much estrogen could be combined with too much estrogen and too little progesterone. If you're taking depot testosterone, as was asked earlier, that extra testosterone can aromatize in the fat cells into estrogen. So too much testosterone can actually make you estrogen dominant. So you might want to keep an eye on that. I heard burdock root can be hormone regulating. Do you have any info on hormone regulating foods and other good hormone regulating? I haven't heard much on burdock root. I know it's good for, a lot of people use it for detox programs. A hormone, or an herb that is obviously the best for balancing your hormones, I believe, is maca root. And I've said it a million times, I think Feminescence is the best product out there right now. It's specifically tailored to maca pause is good for women in menopause. There's maca life for women in perimenopause, and there's maca harmony for women that are either having issues with infertility or issues with PCOS. Lori, what's the best way to accurately diagnose PCOS? That's the million-dollar question, isn't it? So PCOS isn't technically a diagnosis, although we use it, and it is. It's not a real thing that you can say like like estrogen dominant. So PCOS is a syndrome. It's a multiple aspect of things. How we diagnose it is multifaceted as well. We can do an ultrasound of the ovaries and see what's called a ring of pearls, where you have a bunch of little cysts around the outside of the ovaries. You get an FSH to LH ratio, a follicle stimulating hormone to luteinizing hormone ratio. That's a blood test. And usually in a normal operating hormonal system, the FSH to LH ratio is going to be 2 to 1. Generally speaking, in a woman that has PCOS, that ratio is flipped and you have LH 3 to 1 over FSH. That's a generalization, but that's something that we look at. You can look at the insulin resistance that happens in estrogen dominance and PCOS. Insulin doesn't work as well when your estrogen levels are super high. And when insulin is very high, what happens is any carbs that you eat, any sugars that you eat your body's going to want to store those as fat, because insulin is a fat storing hormone. It's helping you, drive sugar into your fat cells. So PCOS patients tend to have a pre-diabetic state or even a diabetic state because they're insulin resistant. So you can measure insulin levels, you can measure glucose levels. So you can do all those things to diagnose PCOS. Usually you're going to use a few of those and not just one to say somebody has PCOS. Another big one is obviously amenorrhea or no periods, or irregular periods, or what we call hypomenorrhea, where you're only having periods maybe 3 or 4 times a year. As far as the maca goes, my phone is falling off again. As far as the maca goes, the product is Feminescence. Please don't ask me to spell it. I'll spell it wrong. Jenny can probably put it up. It's feminescence.net would be the best place. You can get it on Amazon. You can get it at that website. That would be what I would recommend. What other questions do you guys have? No problem. So the way that I look at estrogen dominance, and this is kind of a simplistic thing, but over the last 30 to 40,000 patients that I've seen, trying to make hormones a little bit easier to digest, if you will, is that I've grouped the most common hormone imbalances, and I've come up with 12 of them. One of them is estrogen dominance, and I refer to estrogen dominant women as queens. And I say that because estrogen is the ultimate female hormone. What is the ultimate female as far as energetically and archetypally is a queen. And queens can be very benevolent, or they can be like, for those of you that watch Game of Thrones, they can be like Cersei and off with their heads. And estrogen dominance is that kind of Cersei type queen. That woman that just is not feeling like herself, comes in saying that she feels like she's a little out of control. She just doesn't feel like herself. She's bloated. She's gaining weight. She's retaining water. She's miserable. Her breasts are tender. She's bleeding a lot. She might have fibroids, all kinds of things. So that's something that we want to just look at. I say that because it makes it a little easier to look at that, it's not necessarily a bad thing. And to be a little estrogen dominance, and you might come in and out of it. Actually, during your cycle, during your period, the first half of your cycle, you're estrogen dominant, and that's a normal process. But you then have the progesterone to balance it out. Cynthia, thanks. I have a new book coming out, hopefully in the spring or so of next year, where I talk about all these 12 archetypes and how to naturally help cure those on your own with the things that I mentioned above. And so the queen or the queens, most of the time are fine. They're the benevolent kind of, Queen Margaret types that are ruling the country, and they're doing a good job, and they're taking care of their homes, and they're doing the kid duties, and they're working, and they're doing all that stuff. But you can also get thrown into that, what we would call Cersei Lannister state. And I will tell you, I read the first Game of Thrones book in 1989. So I'm a geek and I'm a fan, and I was blown away by the episode last night. I just have to say that. So my queens out there, you don't have to fret. You have what do queens have? The best queens have people around them that can help. They can't do it all themselves. So gather up your troops, your husband, your kids, your friends, your relatives, your doctors. Gather the people around you that you need to help you, and find a way to help with the diet, help with the exercise. Get some supplements going like DIM. That can help with that, or I3C, indole 3-carbinol is another one that's also along the spectrum of DIM, if you can find that. You can buy those at any health food store. You can buy them on Amazon. It's something that's easily obtainable, and it works. I do think DIM works wonderful. Actually, some of your men, especially men that take testosterone, men also aromatize testosterone to estrogen. So some of your men that are on testosterone replacement can have high estrogen levels, and they need to be on DIM as well. So some of your men might be having side effects of estrogen dominance, and they could have water retention, high blood pressure, redness in the face, and it may just be that their testosterone is converting to estrogen. So especially if your significant other is taking testosterone supplementation in a higher dose, which men do, you might want to have them on a DIM supplement as well. Chris Martin just joined. Chris is a great friend. Love her to death. She doesn't have any estrogen dominance, I am sure, because she's perfectly normal and wonderful. I'm not saying if you have it, you're not, but you usually don't feel very good. So what questions, any more questions do we have? And I just say nice stuff like that to get the thumbs up and the heart. So, it's shameless. I'm aware of that. But, the more likes you can get, it just makes you feel good at the end of the day, really. what other questions do we have? I know we've got 21 people on now. So we're talking about estrogen dominance, polycystic ovarian syndrome, birth control pills, estrogen and hormone replacement. The three type of estrogens in your body are estradiol, estriol, and estrone. Estradiol is the most potent of the three, and estrone is the weakest. Thoughts on coffee enemas? You know, it's interesting, Cynthia. I will honestly say I have never done one, and I'm not sure if I will do one, but a friend of mine, Veronique Desanlier, who is the breast cancer conqueror on Facebook, she has a book out, and she believes that coffee estrogen dominance is related to liver dysfunction or liver toxicity, and she thinks that you can process your estrogens more properly if you detoxify your liver, and she thinks the best way to do that is with a coffee enema. And from what I understand, they sell kits that you can do it at home. I don't know if you make that a date night or what you do with that, but she told me, I just saw her this weekend, and she did tell me that she's going to send me a kit. So that will not obviously be a Facebook Live, but I would like to know your thoughts on it, Cynthia, but I do know some people that are big advocates of it. How does one know how healthy their estrogen receptors are? Leave it to Maria to ask a question that I don't have a great answer for. I guess the way that I would tell that right now would be something along the lines of, if your estrogen levels are decent, like if they're in the middle, and you're not having symptoms of estrogen deficiency like hot flashes, mood swings, irritability, which can also be estrogen dominance syndrome. But if you're not having hot flashes and things, then I would imagine your estrogen receptors are working fairly well. Now, if your progesterone levels are super high, that can make your estrogen receptors slightly dysfunctional. I think we're looking at things, you know, I'm a simplistic person, Maria. I try to make things as simple as possible. And I think when we start getting into things like estrogen receptors and, you know, some of the more scientific stuff that some of us like to pontificate on and talk about in our fun social circles, I think we lose a lot of the patients because they just want to feel better. And so women that have estrogen receptor issues, they're probably going to be a small part of the women that actually are looking for help. So Cynthia says she believes that coffee enemas are a profound way to address estrogen dominance in some, and obviously there are more advanced ways to support liver detox. And I would say the same thing. You can use something as easy as silymarin or milk thistle. Milk thistle has been around for, you know, centuries, and people have been using that to detoxify liver. And actually, there's some studies on silymarin or milk thistle that show that it improves liver enzymes and things like that. So just wondering if you know anything about metal tox with spine degeneration. Gosh, that is not my forte. Trying to think of somebody that I could refer to. I'll look back at these posts. I'll find one of my friends that's good with something like that. You might want to look at Dr. Jerry Bailey, Bailey, on Facebook. Sorry, these things are supposed to stick to anything, and they don't stick to my wall. Dr. Jerry Bailey is a great resource. Thaddeus Gala is a good resource, Gala. Peter Osborne is a great resource online, so you might want to look one of those guys up. But I will freely admit metal toxicity and spines are not my thing. The first half of the menstrual cycle is estrogen dominant. Can you please elaborate on that? So what happens in the first part of the cycle is your estrogen levels peak and then start to trail down. So you're recruiting a bunch of small cysts in the ovary, and then one of them eventually becomes dominant. When you're recruiting all those small cysts, like 15 to 20 of these, they all start making estrogen. So it brings up the estrogen level. And what the estrogen level does when it comes up like that is it thickens up the lining. So it's preparing the uterus for an eventual implantation of a baby, which is supposed to happen. And your estrogen level or your progesterone level is way down here. So in that state, you're quote unquote estrogen dominant. It may be a normal estrogen level for that part of your cycle, but it may not be normal. It may make you feel a little off. You know, you may notice that you retain water in that part of your cycle. I had Isha removed and had an anterior lift following. Well, there you go. You're welcome. When using all exogenous hormones, SHBG is going to elevate, correct? So what's going to make sex hormone binding globulin? So let's talk about sex hormone binding globulin. SHBG is think of it as something that's floating around in the bloodstream, and it grabs onto things like testosterone and makes it inactive. So the higher your sex hormone binding globulin is, the lower some of your other hormones are going to be. And so it's a delicate balance. Well, what happens in estrogen dominance is your sex hormone binding globulin is going to go up, which could make some of your other hormones not work as well. So usually when your physician or your provider orders a hormone panel on you, they should include a sex hormone binding globulin, because you want to see, you know, if your estrogen goes up, that's great, and if you're feeling better, but it could be that it's actually lowering your testosterone, which may not make you feel great at all. So, you know, you can't, hormones are funny, you know, and people talk about all the time in their books about how hormones like an orchestra, and it's true. They play off of each other. The same thing with thyroid hormone. So, you know, the higher your estrogen goes, you can increase your thyroid hormone binding globulin, which can make your thyroid less active. So you have to be careful when you're just, you know, picking hormones here and there and saying, oh, you need to do this or you need to do that, because something that you do on one end can affect a hormone on the other end. So it's not an easy answer, but it's something. That's why I think you go to people that are comfortable with looking at all the values and not afraid to, you know, do some trial and error, get multiple data points, not just one lab set, but multiple lab sets over time to see how you respond to certain things. What else do we have? Anything else? Anything on any of the other hormones real quick? I'm going to try to do these once a week. Next week we'll probably talk about progesterone. I'm also thinking about getting these transcribed so that I can have them in a typed out format and question and Q&A kind of a format, so that we can you can read these later on if you don't want to watch through the whole video. Anything else? Going once, going twice. So what we'll do is we'll probably end for today with the estrogen dominance, because my phone's going to fall off the wall. And we'll come back next week and we'll talk about progesterone. And I'll try to talk about the different archetypes as well. Like today we talked about how estrogen dominance is the queen. And the queen can be benevolent. The queen can be crazy, like Cersei Lannister. And it all depends on the level of your estrogen. Jenny, real quick, what's the best way to test for these hormones? There's saliva, serum, and urine, and in that order. I think saliva, and this is just my opinion, I don't like testing with saliva. Saliva levels are not necessarily very reproducible. They're not as accurate. They cost money. Serum or blood is very accurate, but it's only accurate for the second that the needle's in your arm, right? So as soon as you walk away, you know, later that night, your level could be slightly different. So I don't mind doing serum. The nice thing about serum or blood is that it's covered by insurance. So that tends to be a go-to, usually more than some of the others. The third is what's called a Dutch test, which is a 24-hour urine test that is probably one of the most, it's not more accurate than blood, but because it's over 24 hours, it definitely gives us results that are better. It also gives you cortisol, melatonin, oxidative stress, and it gives us breakdown products of the estrogens to see if you're moving into carcinogenic forms of estrogen or protective forms of estrogen. Those tests cost anywhere from $250 to $400, depending on where you order them. Interpret lots of Dutch tests. There's lots of coaches out there doing them. There's lots of doctors out there doing them. It's just a more costly method. We've been doing blood tests for years. They're simple to interpret, but sometimes you need more data points because it's not always the greatest that you get off of just one. So what I tend to do is I'll order a lab test, I'll make some recommendations on hormones, and then I have the patient come back in about 6 to 8 weeks, and we'll order another blood test if she's not feeling quite up to snuff, and then I'll have 2 data points and I can compare things. So you can tend to see trends that way. And usually, like I said, it's covered by insurance. The interesting thing is if the blood isn't covered by insurance, it's going to cost about 3 times the Dutch test. So if you're a cash paying patient, I would just go with the Dutch screen. It's probably going to be cheaper and it gives us way better information. So Cynthia, don't forget, we need to do something together. Go ahead and post your link again so people can find you on Facebook, and come on back next week or ask me questions under this post, and we'll see you guys real soon. Okay?